Frontline Doctor is hoping to clarify information surrounding COVID-19. One America's Pearson Sharp has more.
Since the pandemic began, Americans have endured lockdowns, involuntary quarantines, mask and vaccine mandates, and a war on common sense. And we're no closer to getting through this than we were 18 months ago. And many believe that's been the plan all along, as the government continues eroding our rights and freedoms with no end in sight. But people are resisting. We've had enough. And from police to firefighters to transportation workers and even healthcare workers, Americans are standing up to these tyrannical mandates. One such doctor on the front line to the pandemic is Dr. Brian Tyson, the owner of All Valley Urgent Care Clinic in El Centro, California, a desert town on the border with Mexico and a major hotspot for the Chinese virus. Dr. Tyson has been combating the virus with astonishing success, using methods that political figures like Anthony Fauci claim don't work. Using a combination of hydroxychloroquine, ivermectin, zinc, antibiotics, and vitamins, Dr. Tyson has a stunning success rate of 100% for patients who begin treatment within 7 days of COVID symptoms. So far, he's treated and cured over 6,000 patients, saving lives that would have been lost if they'd followed the advice of the mainstream media or the high prophet of pharma, the good doctor and dog murderer, Anthony Fauci. But despite what should be a simple case of following the science, these issues remain some of the most controversial and misunderstood topics in America today. Here to discuss them with me is Dr. Brian Tyson. Dr. Tyson, thank you for coming on the show.
Thanks, Pearson. Thanks for having me.
Absolutely. So, first off, I want to talk about the drug that you're not allowed to talk about, the one that is the safest drug in the world, that has no known drug interactions, that saved millions of lives across the world, changed and revolutionized healthcare in Africa. Ivermectin. Tell me about ivermectin. What is the deal with it? Why can't we talk about this?
That's actually a very good question. Ivermectin has been around for many, many years. Great safety profile. Won the Nobel Peace Prize.
Won the Nobel Peace Prize.
And it's FDA approved, and we want to use it for off-label uses to treat viral infections. All the studies have shown that it is a potent antiviral. We know that it is a zinc ionophore, meaning it helps promote zinc going into the cell to stop replication of viruses. That's what we're using it for and under the basis for using it, and that's how we know it's successful. And we've been able to use it in early treatment for COVID-19 since October, believe it or not, of last year, for almost an entire year, with a lot of success. And why we're not allowed to talk about it, I don't know. Why it got labeled a horse medication.
Right, that's the big question. So you've kind of explained how it works a little bit, but how do we know that it actually is effective? How do we know that if you're prescribing it, that it is working against the COVID virus?
Well, number one, studies have proven that it works. And we've got now over 200 studies that show that it's effective. When used in combination of treatment, in my clinic, which we use ivermectin, hydroxychloroquine, we use steroids, we use zithromax or doxycycline, we use aspirin and budesonide. It started on treatment between day 0 and 7. We have a 100% success rate. 100% success rate. If used after day 7, we have a 99% success rate.
So what is your response to the people who just come out and, use that old tired line? It's horse dewormer, it's barnyard animal medicine. What do you respond to them when they say that?
If you buy it at Tractor Trailer, yes, it's horse medicine. But if you allow prescribers to prescribe it to the pharmacy and get the actual prescription, you don't have to get it from Tractor Trailer. You don't have to get it from the veterinary store. You can actually get the human form, which is designed and dosed according to your weight for human consumption.
Now, Merck makes ivermectin, but they've stopped making it, is that correct?
That's correct, because it went generic and the profitability on it diminished, so they stopped manufacturing the drug.
So are people going to be able to get ivermectin from now on? Are people in Africa, or the millions of people who've been using it to save their lives, are they just out of luck?
Good question. Good question. And the next question is, why did they seem to do so? Well, because now they're coming out with their new pill, right? That is supposed to be effective against
Molnupiravir, right?
COVID-19.
Right. So what's the deal with molnupiravir? How does that work?
So that was
And is that a direct replacement for ivermectin?
well, number one, it's not a replacement. It's two different.
So they're not interchangeable?
No, completely two different drugs. Molnupiravir was actually designed to treat influenza, okay, but it failed. It failed to treat influenza. So now they're trying to rebrand it and remarket it for a treatment for COVID. The problem with the drug is its mutagenicity.
Now, what does that mean?
That means it's cancer causing. And
So we know that for a fact, or is that a suspected side effect?
That is a suspected side effect. And so again, until these things are proven and we can see a real strong safety record with the drug, I would be real cautious in taking that, especially over known drugs with known safety profiles, like ivermectin.
So are they rolling this out now without the proper testing that you're saying? Or are we going to start finding these cancer patients down the road because we just started using it without proper safety protocols?
We've started using a lot of things with COVID without really looking at safety and data. It's still going to come under a emergency use authorization. Again, and we know that with the emergency use authorization, the only way you can get that approval if there's no other alternatives. So it goes back to what we've always talked about, which is they don't want outpatient treatment because they want emergency use authorization treatment, right? So
which also exempts them from any accountability for the drugs that they're pushing, correct?
Right. So if there's a problem with the drug, they can say,
they're immune.
They're immune because we gave it to everybody because there was no alternative. So better to have something than have nothing. Right?
Not always.
But that's their argument.
Right.
Our argument is just the opposite, to say, hey, wait a minute. We have proven therapeutics that work. We have aspirin trials. We have ivermectin trials. We have hydroxychloroquine trials.
We have for the last 30 years in ivermectin's case.
And we have FDA-approved drugs that can be repurposed to treat COVID-19. So why are we being told we're doing something bad, and you're telling us that we have to replace it with something that's not even FDA approved?
It's totally untested.
Untested. We don't know.
And the other important distinction is that ivermectin was like $20 a dose, like for a course of treatment, and the new one, molnupiravir, is over $700.
I always say follow the money. We've talked about that before.
Yeah.
Follow the money. If the money's going one way and all the mandates and all of the pushes to that way, well then there's your bottom line. I still don't understand why the NIH and the CDC haven't even recognized aspirin. So the new aspirin study that came out that showed aspirin has a 46% reduction in mortality. That's
for COVID-19.
For COVID-19. That is exactly what they're claiming the new drug molnupiravir can reduce mortality by 50%.
So the question is, as a doctor, are you going to be prescribing molnupiravir to your COVID patients?
Me personally, no. I don't see the need to. If my track record is working, if the treatment that we're using is working and it's not broke, I'm not going to fix it. I'm not going to try something different and see what happens down the road. I'm going to use what's proven.
So another big question, I want to talk about the vaccine. You're a doctor on the front lines treating patients in what has been a pretty hot spot for COVID cases. What are you seeing as far as reactions to the vaccine? How are patients responding to it?
So the number one response that we have is we had a lot of adverse reactions compared to other vaccines. And adverse reactions, a lot of it was myalgia. We're seeing chest pain, shortness of breath. We're actually seeing even some pulmonary symptoms and even positive
heart inflammation,
pulmonary inflammation.
And that can be fatal in some cases.
It can be. And the other interesting is we've had now 4 kids come into the clinic with myocarditis.
Are these kids who have been vaccinated?
These are kids that have been vaccinated. So in the 12 to 16 that was supposedly approved, we had a lot of kids in our area trying to get back to sports and things. So they started taking the vaccines, and we've now had 4 cases of myocarditis.
Okay, well now the question is, with myocarditis, how common do you normally find that in this age group? Is that something that you would see a couple cases a year, or would you say it's safe to attribute this to the vaccine?
In my career, which is almost 20 years, I have never seen a case of myocarditis until this year in a teen or child.
And now you're seeing 4 of them.
And I've seen 4 in this year. I have seen it in the adults, and I have seen it in the immunocompromised adults, but I have not seen it in kids or adolescents.
So let's give them the benefit of the doubt, or maybe play devil's advocate if you want to. Ignoring all of the side effects, put those to the side. Does the vaccine work at all, even a little bit, at preventing or treating the symptoms of COVID?
I would say probably initially, I would have said, yeah, there probably was some protection. And I'm talking December, January, February. With the elder population, it did seem to save off some infections in that time period. However, as times moved on and variants have emerged, the vaccine was designed for the Alpha variant, the original,
not the Delta,
not the Delta, or not even
any of the other ones.
The new ones that are coming out. So now it does not appear to be working well. We're seeing equally amount of vaccinated and unvaccinated people with COVID-19, but who are not seeing, and what nobody's talking about, is reinfections. There's been only 12 reported reinfections out of 30,000 in the Imperial County. The Israeli study with over 800,000 people reported less than 1% reinfection rate.
For people who had natural immunity.
Who had COVID before.
Right.
So natural immunity still seems to be the winning combination at this point with early treatment, as opposed to vaccines to prevent infection, which we know that doesn't happen anymore. Vaccines to prevent hospitalizations, which we know that doesn't happen. That's not happening anymore.
And I think the Israeli study, and I think a couple others, have found that natural immunity outlasts the vaccines by far. Well, that's over a year, they found.
Over a year. Yeah, over a year.
Whereas, like with the boosters, we're now needing every 2 months or every 5. They're changing it all the time.
Well, I mean, we haven't even had the vaccines out for a year.
Right.
And already we're on booster number 3, and Israel's on booster number 4. In our clinic, I can tell you, and as an example, both me and my wife had COVID-19 back last October. So here we are a year later, and neither one of us had been infected.
And you work with sick patients all the time.
Every day.
You're constantly exposed.
Yeah, we were at the clinic today, and we saw COVID-19 patients before coming here. So, natural immunity is the winning ticket. Now, the question is does everybody need to go out and get COVID? Absolutely not. Can the vaccine prevent you from the severity of disease? That's what we hear a lot. Maybe, maybe not, but it does not appear to be the case now.
In your experience, they say, well, it's natural to get a booster shot. You have to get the flu shot every year. But in your experience, is there any other vaccine where you need 2, 3, 4 shots every year to prevent getting the disease?
No, and it's very obvious that the overreach on the vaccines is here, because again, you're not going to say now you need 4 booster shots a year. Every quarter you need to get your coronavirus vaccine to prevent coronavirus, but yet we still have coronavirus.
It's not going away.
Right. If 84% of Californians are vaccinated, and we still have an outbreak of coronavirus, well, then that should tell you
right
that the vaccines clearly.
Because I think they were saying, like in the beginning, the FDA was saying we need at least 80% vaccination rate before we can put this behind us.
And we're there.
Yeah.
But yet we haven't put it behind us.
Right.
You
So there's another very controversial issue, and I wanted to ask you about this. There are disturbing reports that the vaccine was created using fetal tissue from aborted babies. Is that actually true? Were aborted fetuses used in the creation of these vaccines?
It appears to be so. When you look at what Pfizer's documents had in that email that Project Veritas broke, and the Pfizer employee brought to light, clearly they were using aborted fetal cells in the development of this vaccine. It seems to be probably almost like a standard of practice with some of these pharmaceutical companies when they're using these things to use aborted fetal cells.
So that's a fairly common practice for developing vaccines?
It seems to be so. When you're dealing with live tissue cultures, that's what they're using. Now, they should have disclosed that. but instead they hid it. And that's sad because, again, when you're talking about trust and you want a public to trust you.
You want to be completely transparent.
Right, with a experimental vaccine. And I keep using it, is it even a vaccine? Doesn't even appear to be a vaccine.
It doesn't fit the definition
No,
of a vaccine.
it fits more of a therapeutic.
Or a treatment.
Or
Right.
a gene therapy.
Right.
Okay, than it does an actual vaccine. But if trust is the issue, then you need to be transparent and you need to be trustworthy, right? If you're not going to be trustworthy, then we're going to look at your past behaviors. And when you look at Pfizer's past behaviors, if you Google who paid the highest criminal fee in the history of the US, you're going to see that was Pfizer. They paid out something like $4.3 billion for misleading the public. Well,
And now this is the same company that we're supposed to be
same
trusting.
company we're supposed to trust,
Right.
and we're finding out that here we are being misled again.
Yet again.
Not only with the fetal cells, but even in the FDA approval of their vaccine.
Right. Right, that was something else I wanted to ask you. The vaccine that Pfizer is giving people now, is that the same one that received FDA approval?
It does not appear to be so. And if you go to the Comirnaty.com, you go to their website, it will say that Comirnaty got the FDA approval, but is distinctly different than the BioNTech Pfizer vaccine.
So when people say, oh, it's safe to take, it's got FDA approval, that's not actually true?
Well, they claim that there's no change in safety or efficacy, but it clearly said that they are two distinct brands. So if they're two clearly distinct brands, and the BioNTech vaccine is still under emergency use authorization, is that then not misleading the public again? I think it is, because if it's EUA still, emergency use, then we have the right to say no. We have the right to decline it without any recourse from declining it. We are not to be coerced into getting it. That's per the FDA website. Mandating everybody to get this vaccine that is still emergency use authorization based on a claim that it's identical but distinctly different from the FDA approved vaccine, to me seems like a bait and switch.
I was going to say it is. It's a bait and switch.
Bait and
So
switch.
we're not getting the one that they said is approved.
It's not even available here.
Right. So that's the other thing I wanted to ask you. There have also been reports that the vaccine that was originally released, like back in December, had something like 2 or 3 key ingredients, and the one they're issuing now has something like 7. Is that accurate? Am I understanding that right?
I think, again, transparency. It's really hard to follow the paper trail on that. I can't speak to that because I don't know, but I've heard reports. And again, I would go back to when something's emergency use authorization, the totality of the ingredients and everything does not have to be listed, because you're supposed to be told it's an experimental treatment because there's no alternatives. They're not giving you the full story. When you get something that's FDA approved, now you're supposed to, you have a specific time frame to disclose all of those ingredients, okay?
And they're not doing that.
But they're not, because the BioNTech is still under EUA.
Right. It's their umbrella. It's their shield.
It is their shield, and it's their shield against liability.
Right. And that's the other thing, is that if they want transparency, if they want the public to trust them and to stop fighting this, they should be more open about what the consequences of this are. Because, I mean, even the Occupational Safety and Health Administration, they're no longer enforcing employers to report the negative side effects that employees get after receiving the vaccine. What possible reason could there be for them doing that? How does that make sense?
It makes no sense, and that we go back to looking at safety data reports. If I don't get the data on the safety of something that's experimental, then it needs to be it should be shut down. And the FDA promised to protect us. When the drug companies in the late 80s said, we're no longer going to make vaccines because we're afraid of the liability, the FDA stepped up and says, we'll protect you, but at the same time, you're going to be you're going to have to report to us. And if we don't like something, we're going to pull it. That's why previous vaccines, when they had issues of 6 children dying, got pulled off the market right away. Because the FDA's job is to then protect the public.
That system seems kind of broken.
It seems really broken, because when you look at the VAERS data system, compare that to the CMS data system. And CMS is the Medicare data system. CMS reported 46,000 seniors dying within 2 weeks of getting their vaccine. 46,000. Now you can say there's going to be a good group in there that probably was normal.
Going to die anyways.
Right? They're all over 65.
Right.
We expect that. But 46,000
within 2 weeks.
Within 2 weeks.
Yeah.
And then the CDC changed their definition of fully vaxxed to 2 weeks after the vaccine. Little 2 weeks.
Go back and listen to that again.
And CMS is the Medicare data system. CMS reported 46,000 seniors dying within 2 weeks of getting their vaccine. 46,000. Now you can say there's going to be a good group in there that probably was normal.
Going to die anyways.
Right? They're all over 65.
Right.
We expect that. But 46,000
within 2 weeks.
Within 2 weeks.
Yeah.
And then the CDC changed their definition of fully vaxxed to 2 weeks after the vaccine. A little coincidental. So again,
highly suspicious. I would say not even coincidental.
Yeah. And why is the FDA then not publishing that and protecting us from that?
Right.
We know the incidence of myocarditis in kids. We know that it affects teenage boys 7 to 18 times more than women. Okay? And we know that they had to put that and issue that statement in the vaccine adverse events reporting before giving the vaccine. But now they're going to mandate it?
Yeah. That's the other thing I wanted to ask you too is, when we do these reports and we talk about all of the reports that are coming out and being published about how dangerous the vaccine can be, we often reference VAERS, the VAERS website, and people always comment and say, you can't trust VAERS, it's not reliable, all those reports are unconfirmed, it's not a good place to, report these things from. But, is that actually true? Because what I've researched is that doctors are required to report to VAERS, hospitals are required to report to VAERS, insurance companies are required.
It is a mandatory reporting system issued by the CDC.
So is it reliable?
It is reliable. It's not 100% like anything. Yes, I can be Joe Schmo from down the street and I can report a bad outcome into VAERS. But those outcomes are supposed to be looked at and then they get thrown out. Okay? Every outcome and every report is supposed to be looked at and validated. Okay? Where's the validation of the VAERS data? If it's so bogus, where's the actual data then that they did verify? Because you can't sit there and tell me that out of hundreds of thousands of reports that they're all bogus. Nobody's going to file 250,000 bogus reports.
If this was a totally bogus system, the CDC requires you to report to that, don't they?
They do. So if that's the case, then why have that mandatory reporting requirement?
Right. Yeah, it isn't reliable. The other thing, people are fed up with all of this. They're pushing back. We just had the sick out. Keep your kids home. Don't go to school. Protest these tyrannical mandates. Is there any logic at this point to enforcing these practices on kids, to force children to get these vaccines? Does that make any sense from a medical standpoint?
From a medical standpoint, no, because here's the precedence. Number one, the COVID vaccine does not prevent you from getting sick. The COVID vaccine does not prevent you from spreading COVID. Okay? The viral load in the vaccinated versus the unvaccinated has been determined. It's exactly the same. Number three, they still completely discount natural immunity. Those who've had COVID before do not get COVID again, therefore do not spread COVID.
But there's no distinction between them.
But they won't, and they won't even recognize it. However, when you look at if you can still catch it and spread it, it becomes no longer a public health issue. It becomes an individual choice issue. So now we go back to informed consent, right? So anything in medicine always goes back to informed consent. If you need a procedure, if you need surgery, I can explain to you the risks and the benefits, and you as the patient need to decide whether you're going to go along with treatment or not. If I'm going to give you a medication, here's the medication, here's the side effects, here's the risk profile, here's the benefits. It's up to you and the doctor then to decide whether you're going to continue with that medication or treatment. Mandates in medicine, okay, especially for something that doesn't prevent disease nor the spread of disease, is, in my opinion, 100% illegal and actually criminal. Because I cannot give another example of something to mandate to somebody without informed consent that potentially could give you a disability or death and tell you that you have to do it with no liability.
When you have no choice whatsoever.
You have no choice whether you like it or not. And now, your kids. Now we're going to mandate it that your kids get it or they can't get an education. Not even measles, mumps, and rubella
Has that kind of requirement.
has that. No, you can get exemptions and you can fail. You can opt not to give certain vaccinations, but your kids can still get an education. I've never seen it. I mean, why have a consent form then?
It's meaningless at that point.
Exactly. Why have a consent form? If you're going to mandate it, then forget informed consent. Tell everybody we don't have to get informed consent now for any procedure, because if the government says you have to get it, well then you have to get it. So what's next?
Well, I mean, what's next is people are getting fired. They're leaving their jobs. They're making a protest by not showing up to work, and that's happening with hundreds of thousands, millions of people across the country are not going to work over this. And what does that say about the seriousness of a pandemic when it's supposedly the worst one we've ever faced, the most catastrophic disaster this country has ever gone through, but yet we can afford to let millions of healthcare workers not go to work? What does that say about how serious it really is?
Well, number one, it tells you there's not an emergency.
Right, exactly.
So if there's not an emergency, then the government powers of the emergency powers that may be, all of those mandates are now null and void. So the California governor, okay, Gavin Newsom, should then rescind his state of emergency because he can afford to lay off 40 to 30% of the healthcare force.
While he's going to eat at 50 restaurants,
Right.
while he's not wearing a mask,
if the state can
while
afford,
his kid is going to school.
right, but if the state can afford to lose this amount of workers, then there is no state of emergency. So rescind the order, Gavin. Rescind it. Because it's no longer valid. If you can lose 30 to 40% of your workforce, there is no state of
Clearly there's
emergency.
no emergency.
All right, if that's the case, the mandates go away.
We're getting short on time. One last question I want to ask you. Based on all of your experience, could we open the country up today?
Absolutely. There's places that's been open since this whole time.
Is there any reason for
Good.
any more lockdowns or vaccine mandates or masks or social distancing or capacity limits? Is there any reason we couldn't go back to normal today?
No, there's absolutely no reason. And the story is this. If all of the mandates worked, we wouldn't be here today. If they don't work, well, we're still here today. And if we can continue to do what we've been doing this whole time, which is still go to work, go to school, do these things, then there's no reason why we
Live
can't
life normally.
There's no reason why we can't live life normally. Sweden did it through the whole time. Guess what? Sweden's still here. You know, look at Texas, look at Arizona,
Florida.
look at Florida. You know, look at Tennessee.
Florida has a lower case rate than California.
Yeah, but you know what's interesting about that is California's case rate is now dropping dramatically. There's only now 10% infection rate in San Francisco.
Well, that's because everybody got vaccinated.
Well, so be it. Then let's go back to life. If that's truly the case, then great. We've reached herd immunity, and let's move on. Again, emergency's gone. It's gone. We don't need to vaccinate anybody more because the case rates are dropping.
All right. Dr. Brian Tyson, thank you for coming on. I appreciate it.
Thank you.